Back again and talking about a startup from New York, New York. As I mentioned a number of times, I think previously, my former stomping grounds lived in right next to Little Italy, Soho, and Chinatown. For those of you who know the area, Spring Street. So, yep, familiar with New York, and also the Upper East Side, among other areas. But anyway, former stomping ground. There's a lot of hospitals in New York, no shock. And I'm going to talk about a healthcare startup, which oddly enough is funded by a pseudo government entity from Connecticut, even though this is supposedly a New York based startup. So that's interesting. Let's start off. Okay, the industry, as I mentioned, healthcare. It's a bunch of word salad, their solution, but I'll tell you what it says. Holistic solution for multi specialty value based care. Whatever the heck that means. Website, you can find out a lot more details that you may or may not want to know. Conducehealth.com. I forgot to mention at the top, yeah, the name of the company, Conduce Health. Product market fit, too early, I would say. They just raised $3 million in seed funding, so no product market fit yet. And what is the problem they're addressing? Well, if you've ever had to deal with the kind of healthcare system in any way, and I'm sure you have, well, it's convoluted, it's complicated, it's confusing, and it's definitely not efficient. So this apparently streamlines and directs processes. There's software, and I think there is an AI component. Maybe someone else can correct me if I got that wrong, but I think there's an AI component that helps make that happen. So I guess this is another AI startup, and it's kind of combining two things, two trends that I've noticed previously, which is AI, which lots of people have spoken about, and AI startups are raising tons of money. And the other part of this is integrating healthcare, like bringing together disparate parts of healthcare that people have to deal with in a better, more efficient way. So this company, no surprise, they raised money. They're combining both those trends. So good for them. I think I mentioned Connecticut Innovations is the primary or lead VC. It's a pseudo government agency, and that would be kind of, I guess, a concern for me is why they weren't able to raise funds from maybe more established venture capitalists as opposed to go into the pseudo government agency. But maybe that's okay. I'm not sure. Someone who knows more can chime in. But it's something on my mind, so I thought I'd mention it. I've already said it's a seed round, and total funding. I'm going to assume maybe they had some angel investing. I shouldn't say assume. I would speculate that maybe they had some angel investing to get started, to kind of flesh out their idea before they went to the VC here. But I don't have any proof or data on that, so that's kind of a question mark. Obviously, they're going to need patents for their software, and the market size, I would describe it as niche, maybe niche plus, but at least niche, because they're targeting, multi-physician practices. And, I'm sure there's a good number of those, but from a market size perspective, it's not huge. That's what I'm thinking. Someone who knows more, perhaps you can correct me if I got that wrong. But anyway, that's all I have for Conduce Health. I hope that was interesting. Let me know if I can, add more value to these videos. Happy to adjust appropriately. Thanks much. Have a great day.